There's a few people from the NHS, from the Western Isles Partnership, both NHS and the caller. I'm Sonia Smith. I'm the Occupational Therapy Services Manager, and I also have the responsibility for the telecare technicians. And to my left is...
I'm Kirsty Patterson, Occupational Therapist, who's part of the promotion of telecare in the Western Isles.
And to my right?
I'm Kirsty Street. I'm Commissioning Manager with Western Isles Kids.
So we've been asked to just do a wee 5-minute slot on why. Well, there's a few questions that we have been asked to answer. So we'll just go through that one at a time, and we'll just all contribute to all of the questions. So our first question is, what is it about technology-enabled care that made you want to become involved in the programme? So Kirsty's going to start off with that.
Okay. We just feel it's an additional resource that was available to promote and make it available to technology available to more people. Also, due to the advances in the treatment of medical conditions, people are living longer, and the prevalence of, for example, dementia is increasing. Technology-enabled care enables people to live in their own homes or homely settings. People who didn't cope well in large care home settings are really coping well in small settings supported by technology. Actually, they would have said that their dementia was better with the way they were coping.
Our second question was around, can you provide us with a short description of your tech-funded programme? So the way in which we used funding was to, in the first instance, recruit some additional staffing, of which Kirsty was one of the people, and also to strengthen our workforce who are out there assessing and fitting the alarms. One of the elements of our project is the promotional work. So Kirsty can maybe say about that.
Okay, so we've been promoting to a wide variety of professionals and also individuals that might use the alarm through a multimedia focus, from public articles to doing training with professionals on equipment and focusing on telecare and the different types of equipment available in the community at present.
And we've developed some resources as well to help us with that. So we've updated our leaflet, and we've done a number of publication articles that has gone in local newspapers. And
we've also got a crib sheet that people can use, which has a list of the different types of equipment, so it enables professionals even after the training to refresh their memory, and if they come to a situation, be able to look at. But we also have excellent technicians that are able to support, and it's getting people familiar to ask the questions at initial stages, to then also liaise with our technicians so that they can best support people for as long as possible at home.
One of the other elements of our project was to enhance the work that we've started doing around developing Care First, so that it would capture our referrals and our activity, so that we would have much better quality data available to tell us what is happening in and around the provision of telecare and how it supports people to remain in their own homes. So that work is ongoing. We have another strand which is around making the referral process for healthcare professionals for telecare electronic, and that's really just in the early stages, and working with National Services Scotland to look at how that might be possible. So our next question is, what has been the best thing about your technology-enabled care experience so far? Kathleen, if you want to come in there. I think what was really useful was when we went to the learning events and we could link with other people within Scotland who were engaging with this project, and we could make connections. Being on the island means we don't always have the opportunities to do that, and it's made quite a big difference just putting some faces to names and knowing that we're part of a bigger picture.
There's quite a community out there, and they've certainly been very supportive to us in getting information that we've been able to use to support developing our publications, such as the leaflet and posters, etc.
Yeah.
So they've been really supportive, so it's great being part of that community and having that stronger link with them now.
Yeah. I think people were very generous when Kirsty has asked for them sharing information. We've used that, so we didn't have to reinvent the wheel. Why is tech important for the citizens that your organisation serves?
I think it gives reassurance to family and carers. It also enables people to live in their own communities. It kind of minimises risk. It's just really important for improved quality of life. We're just finding that, with technology, people are just living longer in their own homes rather than moving into long-term care.
Okay. So if there's one thing you could say to colleagues who are still uncertain about tech, what would it be? Locally, we decided we really wanted to emphasize the benefits of introducing tech early in the person's care or in their routine, so that it's seen as something that contributes to their independence and their safety, choice and self-management, and that is not something that's introduced to them when they're in a crisis, and that might be perceived negatively.
Or possibly too late as well. Potentially it's too late when these things are thought about. Mm-hmm. I think also it's about the wider variety of technology that's available out there. It's quite often people go initially for the pendant alarm, but there was quite a lack of knowledge about all the other varieties of telecare that are available out there in the community, and it's getting that knowledge stronger.
Yeah. And our last question was, what is your hope for the future of tech? I think we are really hopeful that people will incorporate considering technology as part of their initial assessment when they go out and they meet with people, regardless of what their profession is, whether they're health or social care professional or third sector or housing partners. We'd want everybody to make that part of their consideration when they think about their own contribution towards the person's care.
And that they think about the bigger picture of telecare as well, and that the use of resources that we've got to the full potential, and that we keep people longer at home safe.
Yes, I mean, we're looking at that to incorporate it in our kind of our assessment process, and for assessors just to make sure that telecare is an option and should be considered first, and see how people manage with telecare with less kind of practical care, and then just add to that just needs more increase.
So thank you for asking us these questions, and we hope people find it useful. Thank you.
Bye.
Bye.